a lot to talk about, and we need to start with exactly what we know in the US is a rising number of cases, a rising number of people getting infected. Is this wave, the second wave, or the continuation of the first wave, less deadly than the first, or are we going to see the number of people in hospital significantly rise in the next 2 weeks?
Yeah, it's a great question. So we are seeing increases in mortality, but we have to think about the epidemiology of COVID-19 shifting somewhat. So, in our prior waves, we really had concentrated epidemics in Florida and in New York and California, and in sites where there was really large academic medical centers bringing in additional resources. There was surge capacity better than the rural epidemic that we're now beginning to see. And so as we move into more rural states, we are seeing hospital surge capacity be tighter. There's less options for that surge capacity, less ICU beds, fewer ventilators. And so all of that may contribute to excess mortality. On the flip side, we also have, some benefits with the therapeutics. So with steroids as well as dexamethasone, which give a therapeutic benefit, although do not completely prevent death. So it's a little bit of a double-edged sword here. We are seeing progress. At the same time, surge capacity is not as good as it was previously.
Jason, how different are COVID policies going to be nationwide if we have President Biden in the White House?
Well, first, I think, it sounds like it's still too early to tell, but if under a Biden administration, my understanding based on their plans that they've reported, they would be providing a much more scientific approach, which will include more measures similar to what's going through in the UK, possibly a series of necessary lockdowns, possibly a series of added measures in terms of requirements for mask wearing, again, allowing the states to really adjudicate those rules and regulations. But I also think communicating to the American people both the severity of the illness as well as the important measures that we all need to, we all really need to get behind. I think the mixed messaging from the Trump administration has sowed confusion and it sowed doubt about the importance of the epidemic. And I think that's one of the most important things that the Biden administration would change.
Yeah. Jason Farley, you also took a first dose of the COVID-19 vaccine yesterday. What was it like?
So yes, I enrolled in the AstraZeneca vaccine. It was the most conveniently available to me at Johns Hopkins at the time, the one we were enrolling in. The vaccine is classic kind of approach to all vaccines. It's an injection. You have to get 2 doses for this particular vaccine. Just a little muscle soreness in the arm. Of course, it was an injection, but outside of that, slight headache the next morning, and just some general muscle aches. Some Tylenol completely cleared that up, or paracetamol completely cleared that up, and feeling fine today. Reporting symptoms from the vaccine every single day. Feeling great. Hopefully, we'll get the second dose in about 28 more days now.